program for you tonight. We may switch around a little bit due to technical difficulties. That won't stop anything. Everybody got a seat? Okay. We will start with a prayer. Frank Kuchar. Frank?
All right. And if you say anything else,
No, I'm think of that.
all right. Let's, if you would please, you guys stand for the pledge next anyway, so Matt will go ahead and quickly. You'll be sitting for quite a while tonight anyway, right? So, let's bow your heads, please. Almighty God, our Creator and the Sustainer of our lives, the author of our unalienable rights of life and liberty, and our right to property and the pursuit of life in accordance with how you would have us pursue it. We give you our thanks and our honor and our praise tonight for all you have given to us. And we are so thankful, Father, that we were born into this country, as opposed to so many of the places in this world that we might have been born into, that do not enjoy these privileges of life and liberty. And we are praying, Father, this evening for our nation, because those unalienable rights given to us from your gracious hand are under assault. The life of the unborn, the life of the elderly, and the lives of all those in between, threatened by those who do not respect life at all, but will take it for any and every cause. And therefore, Father, we realize that we are a nation who has drifted away from the anchor of your law and the laws of this nation, that we are becoming more lawless and godless. And therefore, Father, we entreat your gracious mercy upon us. We ask that you would send us leaders who respect you and honor you first in their lives, that they might then honor that which we have in place to secure our life and our liberty, namely our Constitution. And so, Father, we ask your continued patience with us, strengthen us, and give us opportunities to advance the cause of righteousness in this nation and the cause of liberty and freedom, that all those who come after us might enjoy that which we enjoyed growing up, and we might truly indeed be a light into the world of what you and liberty are all about. Is our prayer in Christ's name. Amen.
I'll do the pledges with Bill Carson.
American flag. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
The Texas flag. It's 17 words. That's all it is.
Honor the Texas flag. I pledge allegiance to thee, Texas, one state under God, one and indivisible.
I say that because earlier today, it just left my mind.
And we thought you had been on mission for a couple of weeks recently.
We have a lot of new people here today. We're very happy to see you. And with that, if you'd like to introduce yourself, stand up, and we'll do it one at a time.
We're really glad to have all the new people here tonight. We certainly want to invite you back. If you don't mind, would you stand up and introduce yourselves? Let's start with this row right here, please.
That would be me. Michael Brown from Ennis.
And if you could tell us where you heard of us or why you're here, that'd be sweet too.
I had a meeting with Donna, and she told me about it, and I'm interested in what's going on about Obamacare.
Good deal.
Let's go with the second, third row, fourth.
These students.
Okay. Go ahead.
Yeah.
My name is Bob Petty. My wife Barbara, we live in Odella, originally from Ennis, and Hugh Reynolds is a friend of mine, and we've attended some of the meetings in the past, and so we're here to support.
That's great. And let's go back. I think, Robert, I met you earlier, you and your wife, please.
Yes, Robert and Alan, my wife Marilyn. We're from just south of Ovilla, and she caught something on the web. Tea Party is having a meeting here tonight, so we said let's go down and find out what's going on. Appreciate your help.
Anybody else on this side right here?
Well, I walked in and seen your class, but I think everybody knows you.
Okay.
My name is Ken Cope. I'm from Midlothian. I'm here tonight, not as a guest of anyone, but I picked it up on the web as well, and I really appreciate the work that the webmaster's done in putting it out there so you could review the previous meetings and speakers. I think it was an excellent job. It got my attention, and I'm frustrated where we are with our government right now, and the lack of, I'm going to say, backbone that our current set of representatives seem to display. I'm very concerned about just not Obamacare, but the national debt. And it seems like we only have one opportunity now in which to do something about Obamacare, and now our elected officials are turning and running from the fight. And I don't think that that's what has made us as a country. We're willing to be fighters, and all of us can participate. And if those are out there on the web, they listen. Part of our concern is, I've been a Tea Party member. I'll say that because I've been in the silence of my home and sharing my views with my friends, and I've been a supporter. And I've looked and wondered, how can I participate now as a retiree? I have a little more time, and I want to go do that. And the message that I hope that everyone gets is that we need the silent majority's participation, and we need it today. Not next week, not next year.
Amen.
And to participate, just your presence is needed to help make this movement so important to help change this country. Secondly, they need to be able to speak. Now, it's not important that you be eloquent, but at least come speak your piece. And if you have an opinion, you can use that opinion to help us fight with our voice.
Thank you.
As one thing. So I appreciate it.
Anybody? You? Okay, please.
I'm Shannon, Sawasahashi. I've been interested for a long time for many of the same reasons, and so many of my friends talk about the issues but don't really care what's below the surface, and so I just think it's really important for us to know what's right, to stand up and do the right thing. And I found you on the internet, but I was really excited that Tim and Sandra were here, and they told me to.
Well, thank you so much. You next?
My name is Harry Truman Cheney, next to the church we've had for president. I'm from Waxahachie. I just heard about this from you, invited me over here tonight, and I just wanted to come and see what goes on in these meetings, because I'm pretty well, fed up with what's going on with our government. It's time that somebody tries to take our country back, because the way it's going right now, it's going to, where our kids these days are, I don't know about anybody else in here, I was born and raised a Catholic, and the Catholic values are gone to hell. Family outlook is gone. Everything's supposed to start at home with the father and the mother taking care of the kids. Now it's the kids are trying to take care of the parents, and this, when I was raised up, that's not the way it was supposed to be, and it's not supposed to be that way now. So I'm glad I'm here. I want to see what's going on.
Well, thank you, Harry, for being here. Harry, thanks for coming. Bob?
Russell, Kathy Brown from Waxahachie here. Been getting the emails for several months from Linda.
Great, good to have you.
Morris?
Yes, sir. I'm
I would reintroduce myself. I'm Ray Robowitz. I'm from Ovilla, Texas. I own ExhibitTrade.com. They're in town. Okay. I know a lot of these guys from the party and the Tea Party and Facebook, and I'm just here to make sure we get a grip on this place, because it's a nightmare out there. I think we're fixing to have a financial collapse. We're fixing to go have a war in the Middle East over there. I think we got more rhinos than we know what to do with in office, and it's time to get them out of here.
Let's roll.
Amen. Anybody else?
My name is Chris Longshire. Live on Cedar Hill, grew up in Red Oak. Just got TJ Avenue about here. I'm serious. I'm fed up with what's going on with our country.
It's good to have you.
Joined the military to fight for something and things going like this.
Good to have you. I just wanted to give you an opportunity to kind of introduce yourself so we know who you are. We want to welcome you. This is an important meeting tonight, and I'm going to cut it real quick, but I just wanted to see a show of hands. How many of you are veterans? Let's give these people a break.
That would be the true 1%.
And for those people that are new, sure we've got your email addresses. We do not bombard you with emails. We send out notifications of meeting times and speakers and things like that. So we will not spam you. So the format tonight is going to be a little bit different. So with that, Penny Story is going to go through that.
This has been a wonderful day. We've had training today for people that want to support the grassroots efforts of candidates, and we've had training today for people who want to be a candidate. So it was a wonderful day so far today, and tonight's even going to be better. Tonight we have two distinguished speakers, and what we're going to do is we're going to pass out 3x5 cards to all of you, and as you come up with questions, would you write those down? Then we will gather those, and we will field those questions to our two speakers tonight after both have spoken.
If you want credit, put your name on it.
Yeah. And so we are going to, first we're going to have Hugh Reynolds, and he has a degree in public policy, and he has studied public policy for 40 years. And so he is not only a student and a researcher, he is also a faithful Christian, and he is a devout American patriot.
Thank you, Penny.
I'm sorry, we had some developments today, so Linda, do you want to come up? We're going to pass the hat, and we're also going to introduce some things that we're going to start doing here very shortly.
Sorry, you.
That's okay.
And my fault. I'm so excited to hear how many people here are here because they found us on the internet. But there's still a lot of people in Ellis County who do not even know that there is a Tea Party in Ellis County. So the leadership team has come up with a flyer that we want to print, and I'm going to send it around. And I'm looking for some sponsors to give this to print. We can print 5,000 and 5,000 business cards. The business cards will look just like this for a little bit under $400. So if you would like to sponsor that, $10, $5, $25, $50, sign your name on here, and then we can take a check to do that. And then also, to rent this room and to keep our website going costs about $125 a month. So we're going to pass the hat. If you would like to contribute for that, that would be greatly appreciated. And as soon as we, get a little bit of money, we're going to print these. And these flyers are really important because in the fall we have Heritage Day, Pioneer Day. All the little towns have special festivities, and we have a booth. And it's a great opportunity to let people know that we are here, especially with the primary going on. So if you're interested in supporting it, sponsoring it, just put your name, and then you can give us money whenever convenient. Thank you.
My turn? Sit down.
I was helping. You were giving me grief all afternoon long about how I couldn't say something in one breath.
Yeah.
And now you jumped on me because I'm helping.
And I also said that you got to saturate your lungs.
I'm going to take my daughter home. Just because I made some comment about him being up in Michigan.
Michigan? Is that up by Texas County?
Well, east and north.
Just testing here. Ladies and gentlemen, thank you for being here tonight. My name is Hugh, and I want to thank the committee, steering committee, Keith and Bill, Linda, Harlan, Penny, anyone else I missed? Thank you for inviting me to speak tonight. Thank you for coming and listening. I think this is an extremely critical issue today for many, many reasons, and I'll be hitting just a few of them. I expect a lot of you may be sick of hearing about what I'm here. Believe me, I am. I've gotten pretty deep into the weeds on this, but I'm going to try and keep this at a high level and just hit some highlights that will give you all something that you can take with you. I think it's really important to keep pressure on our elected officials, our representatives, our senators, state, local, federal. We
need to be armed with knowledge. This is a massive law. By some estimates, it's, I think, 4 times longer than War and Peace, 3 times longer than the King James Bible. It's sacrilegious in many ways, in my opinion. I think this is an atrocity. And by the time we get to the end of the evening, I hope to have given you all enough knowledge to know more about this than most of your fellow Americans, and certainly more than the congressmen and legislators who had very little hand in writing this and certainly didn't read it. My goal is to make the complex simple as I can and use plain English. I might quote the law once or twice, but I'll avoid legalese as much as possible. And we will allow time for questions, as Penny said. We're going to look at 3 broad areas. Mandates, and there are a lot of them. The death panel, and sanctity of life issues. All 3 of these involve issues of life and death for our children, for ourselves, and for our constitutional republic. Now, I like to ask people, have you ever seen Obamacare? It seems like a pretty stupid question. How can you see a law? Well, there it is. Now, you don't need to understand all the details. What you need to understand, and by the way, this is a live web link if anybody's interested. I can send out electronic copies of this. The complexity is almost beyond belief. But the main point to take away is that this is you over there on the right side, and here's your doctor on the left. And this is the maze we have to navigate to get to our health care providers under Obamacare. This is why we call it the nightmare. And this is the version, by the way. It has a few minor changes, but this is the version that was ruled constitutional last year by the Supreme Court. Majority of 5-4 found it constitutional. The court changed very little in the scope of the law, but they made one major change we're going to look at in a few minutes. And by the way, it is not the court's job to amend the statute. This is judicial exercise of legislative power, and it violates the constitutional principle of separation of powers. I believe that the ruling from the Supreme Court itself was an unconstitutional act. Under the mandates, we're going to go through, stay in line with my computer there. We're going to go through 3 major mandates. First, the insurer mandate. We go the right way. The insurer mandates, the employer mandate, and the individual mandate. Now, I'll touch on the insurer mandate and the employer mandate briefly, and I'll spend a bit more time on the individual mandate. First question on the individual mandate is, what is it? Is it a tax or is it a penalty? And we'll find out a little bit later what it is according to the Supreme Court and what it was according to Congress and the Obama administration. How's it going to be enforced? Over 16,000 new IRS agents will be hired, or maybe have been hired, and that number has probably climbed. Who does it apply to? Well, there are millions and millions of waivers and exemptions, probably not applying to anyone in this room tonight. All right, we'll move on to the insurance mandates. Now, I won't bore you with this chart a couple times. I just want to point out that you'll see all these little icons. This one right here is the insurance mandate. Later we'll get into the employer mandate, and finally the insurance mandate, individual mandate. And what is the insurance mandate? Well, requirements under the law render the idea of insurance almost meaningless. 17 separate provisions in the law require that insurers must provide unlimited lifetime and annual payouts, unlimited access to OBGYNs without prior authorization, coverage for all applicants regardless of health status, and comprehensive coverage as defined by the HHS Secretary. In addition, insurers must not rescind coverage, must not exclude pre-existing conditions, and base premiums on health status of the beneficiary. Now, they can call this whatever they want, but this is not insurance. Now, if this was insurance, I would wait until I had a car accident before going out and buying my auto insurance, or wait until I had a life-threatening disease before going out and buying life insurance. But that's not how insurance works, so this must not be insurance. And speaking of tyranny, as defined by the HHS Secretary, means whatever she wants it to mean. Then the employer mandate, and actually there's several of them. A lot of mandates, taxes, and regulations. The law dramatically increases taxes and reporting requirements on employers. I think we all know business people who are really struggling, and maybe some of them failing, or have already gone under because of the requirements of this law. They must inform employees of their insurance options. They have to offer government-approved health insurance to employees or pay penalties, etc., etc. The burdens are amazing. They're onerous. There's a quote here from the watchdog website, ObamacareWatch.org. Obamacare's employer mandate is among the law's most anti-growth provisions. It will destroy jobs, and many firms are likely to slow down on hiring in anticipation of its implementation. Now, that was written several years ago. We've been watching this happen for several years. I think we all know people who are just going under. And now we come to the heart of the maze. Obamacare requires individual citizens to buy a government-approved health insurance policy. This is one of the most controversial and unconstitutional of all the requirements of the law. What is the individual mandate? The law amends the Internal Revenue Code as follows. An applicable individual shall blah, 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 beginning in 2013, ensure that blah, blah, minimal essential coverage. I told you I would skip over the legalese. In plain English, what this means, American citizens must purchase a government-approved health insurance policy under penalty of law. The federal government is now requiring citizens to enter into a financial contract whether they want to or not. Never before in our history have all citizens been required or penalized for not engaging in commerce or from refraining from doing something. I don't want to spend a lot of time on numbers, but penalties beginning in 2014 through 2016 are either a flat dollar amount ranging from $295 to $695 and beyond, or a percentage of your income. And I think the thing we need to keep in mind is that these are monthly penalties, and they are subject to increase. To quote the Wall Street Journal, if Congress can force you to buy insurance, constitutional limits on federal power are dead. If the insurance mandate stands, then why can't Congress insist that Americans buy GM cars, or that obese Americans eat their vegetables, or pay a fat tax penalty? This is the nanny state on steroids. How will it be enforced? Again, the law amends the Internal Revenue Code. They keep coming up. If an applicable individual fails to meet the requirement for 1 or more months, there is hereby imposed on the taxpayer a penalty. Remember that word, penalty. One congressional study estimated that over 16,000 new IRS examiners will be hired to collect the new taxes and audit families and small businesses. And as we have seen, Tea Party organizations are coming in for special treatment. Who's exempt? The law specifically exempts various categories of people. Members of Indian tribes, incarcerated people, also known as convicted felons, undocumented immigrants, also known as illegal aliens, members of religions who refuse benefits, almost nobody. I don't think the Amish will be under the law, but if you accept any kind of government benefits, this law applies to you. Unless you're in the last group, and that's people whose income is too low to require them to fill out a tax return, which is almost 50% of the population by some estimates. Waivers. Now, this has been a hot topic, especially the last couple of weeks. Who gets waivers? As of January 2012, the Secretary of HHS had issued over 1,700 waivers. Businesses, labor unions, health insurance companies, many other groups. These waivers included over 4 million individual employees. And there's a few examples there, and there's a lot more. I think Jimmy Hoffa has changed his mind. Oh, and by the way, the Obama supporters all of a sudden are all up in arms. They're now demanding waivers. The Democrats, the unions, IRS employees who will be implementing the penalties, congressmen and their staffers are up in arms because it's going to cost them more money than they expected. Never mind all of us ordinary, normal, hardworking Americans. These people are now angry about how bad this law is going to be for them and how much it's going to cost them. I've come up with a solution to Obamacare. It's very simple. Waivers for everyone. Now, is the individual mandate constitutional? It was justified by the absurd argument that by not purchasing a government-approved health insurance policy, in quotes, we are negatively impacting the interstate commerce clause of the U.S. Constitution. This is the exact language of the law. The individual responsibility requirement is commercial and economic in nature and substantially affects interstate commerce. In the 1984 newspeak of the Obama administration, by not engaging in commerce, you are substantially affecting interstate commerce without even trying. Did anyone in here sign a government-approved contract for insurance today? Well, then you affected interstate commerce. This is the insanity we're dealing with. Now, let's come back to that question. Is it a penalty or is it a tax? Now, this chart underwent very few changes when it was amended by the Supreme Court. And as I said earlier, it's not their job to amend the statute. The main change was right here. Now, is the Supreme Court ruling itself constitutional? In June of 2012, the Supreme Court ruled that the individual mandate was unconstitutional as a penalty under the Commerce Clause. But then they turned around and declared it constitutional as a tax under the taxing power of Congress. But the law clearly states, and the Obama administration argued, that the individual mandate will be enforced through penalties. That word keeps coming up, and it's all through the law. A majority of the courts, in effect, ruled on a case that was not put before them. It was a bait and switch. And a lot of us were shocked at what John Roberts did because we thought he was a strict constructionist. Well, he found a way to make this law constitutional. That was a 5-4 decision, and writing for the minority, Justice Antonin Scalia stated, "The court today decides to save a statute that the Congress did not write. It rules that what the statute calls a penalty is instead a tax. This is a vast judicial overreaching." Unquote. This is a Supreme Court justice calling his fellow Supreme Court justices on vast judicial overreaching. He's saying, in effect, the other 5 members of the Supreme Court have violated their oath of office to protect and defend the Constitution. In other words, the minority said that this court decision is nothing less than judicial tyranny. All right, let's move on from the mandates to the death penalty. Now, you all may remember a couple of years back, Alaska Governor Sarah Palin made some remarks about this. She was right. Obamacare has also been called the Trojan horse, and we'll take a look at that in a minute. Death by Medicare. There is rationing, and it comes through cost containment, and this panel has the power to curb expenses, to keep costs low, to reduce physician reimbursement, anything to keep Medicare spending within a certain range. They claim it's not rationing. But if your doctor refuses to take any more Medicare patients, the effect is rationing. Finally, wither the Constitution. So we'll be spending a couple minutes on that. And here's the Trojan horse. We'll get a better look at him in a minute. Right here, this circle here, it's a little hard to see, but it says IPAB, which is the Independent Payment Advisory Board. Obamacare created this board with powers to impose medical rationing regardless of what the law says. It says it shall not ration. But in fact, it will ration through cost containment measures. The board will consist of 15 unelected bureaucrats who will be granted powers to make life and death decisions directly or indirectly for all Americans, unless you're one of those with a waiver or exemption. When Sarah Palin called the board a death panel back in 2009, she was right on target. Oh, I'm sorry, she got in trouble for using the word target. I probably will also. By the way, I want to just reassure all of you that this presentation has been fully certified as subversive by the NSA. I remember what you said, where's Penny? I remember what you said at one of the last meetings, that if you're not on at least 2 or 3 watch lists, you're not doing much. Sarah said, "The America I know and love is not one in which my parents or my baby with Down syndrome will have to stand in front of Obama's death panel so his bureaucrats can decide whether they are worthy of health care. Such a system is downright evil." And she took a roasting in the press. And you all remember as well as I do, they not only attacked her, they attacked her family, they attacked her children, they attacked her baby. This is the kind of people we're dealing with. Now, defenders of the IPAB say the board cannot make decisions that would ration care. But when they cut payments so severely the doctors decide to stop taking Medicare patients, this is rationing. IPAB has been called, one second here. I think I missed something. It's been called a rationing board and the Trojan horse of Obamacare. Buried inside this law are provisions giving the board almost unlimited power over Medicare spending, denial of payments, and virtually no independent oversight. It is a, quote, blatant unconstitutional power grab that restricts the power of future Congresses, unquote. The board can limit what Americans can legally spend on health care to hold costs below the rate of medical inflation. They can deny payment for certain medications, change service options, and drive out expensive life-saving treatments. And they can deny treatment agreed upon between a doctor and his patient, even if the patient is willing to spend his own money. What about the Constitution? Oh, here's our friend, the Trojan horse. Now you can see what's coming out of the Trojan horse is not a bunch of Greeks, but a bunch of Grim Reapers. What about the Constitution? As I said earlier, this panel is deaf not only to individuals, this is deaf to our constitutional republic if we don't stop it. In 2009, when Nancy Pelosi was asked, where does the Constitution grant Congress the authority to force Americans to buy health insurance? Y'all remember what she said?
Are you kidding?
Almost. She said in a very mocking tone, are you serious? Are you serious? Well, yes, Madam ex-Speaker, we are deadly serious. The iPad is the most, excuse me, I'm jumping back and forth. Oh, believe it or not, the official citation for the deaf panel in the United States Code is 42 USC section 1395 KKK. I kid you not. All right, the provisions in Obamacare give almost unlimited powers to this administrative bureaucracy with no accountability or oversight. Provisions under IPAP violate and contradict the most fundamental principles and provisions of our constitutional republic: representation, separation of powers, and limited government. I'd like to spend a little time on each of those three. IPAP eliminates representative government. It consists of 15 unelected bureaucrats unaccountable to Congress, the executive branch, or the judiciary. A majority vote of just 8 members, 8 out of 15, can make healthcare policy and decisions binding on over 300 million Americans. Even worse, if only a quorum of 8 members shows up at a meeting, the majority vote is 5. 5 unelected bureaucrats can make these decisions. In the worst case, this power can be invested in just one. Yes, just one individual. If the president appoints only one member, or appoints no one, and the Congress refuses to confirm, the Secretary of Health and Human Services is authorized to exercise these powers alone. By any definition, this is tyranny. What about separation of powers? Contrary to the Constitution's delicate balance of power among the 3 branches of government, the IPAB is invested with the power to make law. They weren't elected, they're not legislators, but the Congress itself has given them the power to legislate. For example, the law directs the board to submit legislative proposals which after a certain time will automatically become law, unless Congress comes up with a better proposal. And we know they don't come up with a better anything. The board is also given the power to raise taxes. Yes, you heard me. Raise taxes and appropriate money for itself. The Constitution clearly reserves these powers to Congress alone. So where's the separation of powers here? Not only will we violate the separation of powers, but we're doing it by a group that's not even one of the 3 branches of government. So, in effect, Congress, so I'm getting ahead of myself. Congress created an administrative agency vested with lawmaking power that the Congress itself cannot undo without violating its own statute. Through this law, the Congress has even forbidden itself from repealing the IPAD. Now, this is not just unconstitutional, this is a self-contradiction. This is nuts. One Congress cannot bind a future Congress. This amounts to one Congress ordering future Congresses not to exercise their congressional powers. Frank, where's Frank?
Here.
Frank. Frank, would you be running for Congress if you accepted the premise that a previous Congress had bound you and tied your hands before you ever got there?
Wouldn't be much point in it.
No? And if you knew that you were forbidden from vetoing or even challenging an abomination like this? Well, if I did, and I wished I had. The law also restrains the president and the courts from altering board decisions. But one branch, and they're not even a branch, as I pointed out, they are part of the executive, but they are not, legislative, but they are not legislators. One branch cannot bind the constitutional powers of the other two branches. I mean, what we have here is Congress abdicating its own power to 15 unelected members. Why don't they all just pack up and go home and we'll declare a dictatorship? Because in a sense, that's what we've done. All right, now, limited government. IPAB makes a mockery of limited government. The Constitution has other built-in safeguards to restrain the power of the national government and protect us from tyranny. These checks and balances are designed to divide power among the legislative, executive, and judicial branches, what I call the horizontal separation of powers. Thanks, Frank, I learned that in your class. Versus the vertical separation of powers, which is the power divided between the national, state, and local levels. Now notice I said national. In its original meaning, federal was different from national. Federal was the relationship between national, state, and local. The IPAB blatantly violates these principles. It can require state and local governments to enact laws to implement its decrees. It can also block health care laws passed by state and local governments. Finally, it can control and limit spending by private health care plans and control health insurance markets, which is what the mandates are all about. This power destroys the distinction, not just through the government, but between public and private sectors. Finally, moving on to our third major area is the sanctity of life. For 40 years now, we have watched I don't want to just say left. There's a lot of folks out there who don't understand what we're up against. But we have watched 55, maybe 56 million unborn babies aborted. And we've called that abortion on demand. I think we're moving into a new phase. Abortion on command. There are also attacks on the sanctity of life by defining what we would call necessary care as unnecessary. There's end-of-life neglect, sometimes passive, sometimes active. And remember the conscience clause? Obama promised churches and other organizations that wanted to opt out of any connection with these attacks on the sanctity of life. And our churches and our religious freedoms are under attack. Abortion on command means that abortion providers will be major beneficiaries of Obamacare, under the employer mandate especially, to provide contraception, sterilization, and abortion-inducing drugs. Consider Planned Parenthood, the nation's largest corporate abortionist. That's what they are. They are corporate abortionists. Planned Parenthood stands to earn billions of dollars in increased sales of free contraceptives and other, quote, preventive reproductive services. Planned Parenthood already takes in more than $1 billion in revenue every year. In 2010, almost half of this billion, 490 million, came from taxpayer dollars. You and me. That's our money funding them. The money they take in is going to expand exponentially under Obamacare with the contraceptive mandate, as businesses are forced to provide these reproductive health care services. This thing is full of euphemisms. Planned Parenthood claims that only a small percentage of its revenue comes from abortion, but in 2010, Planned Parenthood's abortion income was over half of its clinic income. And they play a lot of counting games with their numbers, and they claim that less than 5% of their income is abortion related. But it's much closer to 45, 46%. Now, the defenders of the law argue that it doesn't include abortion funding. But even if this were true, which it's not, every dollar it takes in for other services outside of abortion, that frees up money for them to apply to abortion. Does Planned Parenthood really serve the needs of women and teenagers? As to its claims to provide health care to women, over 90% of the women seeking pregnancy-related care at Planned Parenthood are now sold abortions. I don't know about you all, but yes I do. I think almost everyone in here is as strongly pro-life as I am. I would hope so. Abortion is not pregnancy care. It's murder. Is this what these women really had in mind when they came in asking for prenatal service? I don't think so. How does Planned Parenthood serve teens? By promoting promiscuity disguised as sex education. And then they reap windfall profits by doing STD testing when the kids catch sexually transmitted diseases. So they're benefiting both ways. Oh, and also, when unexpected pregnancies occur, which they inevitably will, they're right there to provide the abortions for our children, our teens. By the way, their lobbyists are fighting parental notification and consent laws all the time. From 2010 to 2014, Obamacare allocated $75 million each year to fund Planned Parenthood-style education in the public schools. According to their website, which I recommend you don't go look at it, it gets pretty ugly, especially the teen site. These programs should ideally, begin in kindergarten. Some schools are now providing sex apps so the kids can go out and find contraceptives and STD testing without their parents' knowledge. As these practices become more acceptable and normalized, mandated and publicly funded abortion will not be far behind. Are we approaching an American version of China's one-child policy and forced abortion? Bishop Lawson, thank you for being here. I apologize for what I'm about to say. I think, in effect, this is happening in many of our poor black communities already. It's not exactly forced abortion, but there's tremendous pressure, especially on our young minority teens. Unnecessary care. Obamacare is rapidly accelerating the definition of what's necessary medical treatment and encouraging the fallacy of death with dignity. The decisions of the IPAB will restrict certain kinds of treatment or withhold treatment from people deemed to be ineligible based on non-medical grounds such as cost containment, quality of life judgments, false compassion, etc. Remember the case of Terry Schiavo? there'll be more cases where basic needs like food and water are defined as medical treatment, which may not come under the approved list of treatments. So the board, in its mandate to control Medicare costs, will inevitably reduce patient care. End-of-life neglect. I'm probably running over time, so I'll speed along here. The IPAB, there's a requirement in there that every 5 years Medicare patients have a counseling session to make sure they know what their end-of-life options are. They have a section called Protecting Access to End-of-Life Care. I think this opens the door to neglect of terminal patients and pressuring the elderly or their families to pull the plug. This is a path to creeping euthanasia. Obamacare, I think, is inspiring some states to push mandatory end-of-life panels. Like Oregon now has a health review commission proposing that Medicaid should not cover treatment to prolong life for some cancer patients. This is the same state that offers terminal patients the option of assisted suicide and then pays for it. Remember the conscience clause? I don't either. It never materialized. This law attacks our most sacred rights, especially First Amendment guarantee of religious liberty. As you all know, many Christian churches, social service agencies, and individuals are being denied their rights to act on the dictates of their consciences. Medical professionals will be required to perform, participate in, or support practices that violate their consciences, their personal ethics, and even their basic sense of humanity. Abortion, sterilization, euthanasia, assisted suicide, embryonic stem cells. Churches and private businesses objecting to the employer mandate have been threatened with fines, court action, and ultimately the death sentence of their businesses. The most prominent example is the Christian-owned Hobby Lobby. In June, they got a court to issue a preliminary injunction to block the mandate, but this was only temporary. I think it's until October 1st, and then it starts up again. The war against Hobby Lobby and other businesses goes on. Finally,